Good afternoon, everyone. We're going to just take a minute and let the room fill up before we get started. Hello, everyone. We're going to just take one more minute before we get started. Alrighty. Well, good afternoon, everyone. Thank you again for joining us for our weekly Wednesday webinar series. Today's webinar is on advocating for your care in the emergency room. My name is Alsa Murtha, and I'm the Manager of Strategic Communications here at the National Hemophilia Foundation. At any point during the webinar, if you would like to ask a question, please use the Q&A feature on the bottom of your screen. We have staff members monitoring these questions, which we will pose to our speaker after the presentation. This webinar is being recorded and will be available to the community beginning on Friday, February 11th. I am joined today by NHF's own Lena Volland. Thank you for taking the time to join us today. How's everything going today?
Good. How are you, Elson?
Good. I'm doing good. Well, I'm going to turn it over to you now to go ahead and get us started.
Thank you so much for that lovely introduction, and welcome everybody to our lovely Wednesday webinar. I'm delighted to be here today and to share some information about being prepared when you have to go to the emergency room. So again, my name is Lena Volland, and I'm the Director of Education here at NHF. But before I came into this role, I was actually also working at a hemophilia treatment center. So I'll bring in some of those stories as well. So let's get started and talk a little bit more about being prepared when you actually have to go to the emergency room. So I just wanted to highlight again our mission here at NHF. And I really wanted to point out to the very last component, which is that we are truly wanting to help families thrive, and being prepared when an emergency happens is an essential component to supporting our families and their quality of care. So sometimes things just do happen. Sometimes somebody might have a bleed, and sometimes it might warrant a little bit more than just a call to the HTC, and you might actually have to go and visit the emergency room. But there are many things to keep in mind before you actually go to the emergency room, and to keep in mind while you're there. So a couple of things to consider is that many hospitals, emergency rooms, EMTs, and paramedics do not deal with bleeding disorders on a frequent basis, and they might not have covered them largely in their schooling either. So their knowledge might actually be slightly limited. So it is important to not only be informed about your bleeding disorder, but also to be able to communicate this information in the event that an emergency happens. And we're going to spend the next kind of 45 minutes or so to talking a little bit more about that. However, I also wanted to highlight a little bit of what has been found in research and what we have known so far, what recently was published. So there was this really wonderful study that was done that was looking a little bit more at the barriers and the challenges for receiving appropriate treatment. And they were particularly looking at those hospitals that are not directly connected with a hemophilia treatment center. So where they not frequently might be interacting with people who do have bleeding disorders. And what they actually found is a couple of the barriers that I'm highlighting here. So very often there is limited access to protocols and guidelines. And in this research studies, they've actually found that only 15% of those that were queried had some sort of a protocol or guideline in place for people with bleeding disorders, and even less for people with other bleeding disorders that are not related to hemophilia directly. They also, as pointed out on the previous slide, had a lack of knowledge about bleeding disorders. They are emergency room physicians, advanced practice providers, and nurses, and they're really there to save your life. They're not like your hematologist who's solely focused on bleeding disorders. So their knowledge base is not as extensive. Normally, they would be pulling in some specialty healthcare providers for those to consult, but very often they actually have limited access or delayed access to an appropriate hematologist who could provide consult in those moments where you have somebody coming in with a bleeding disorder who might be having a bleeding episode. The other big barrier that they identified in this particular research study was that there is often a delay in treatments, and they accumulated that to very often a severity of bleed. So they were differentiating between life-threatening versus non-life-threatening bleeds. And they found that those people who had life-threatening bleeds often would get treatment within the first hour of arriving in the emergency room. But those who did not have life-threatening a life-threatening bleed, they might often wait more than 60 minutes and often up to several hours before they receive their first factor treatment or product treatment. They also highlighted some internal processes that delay treatment. One of the big ones that they noticed here was the approval for the utilization of factor products or bypassing agents in those instances where somebody might have an inhibitor. So a lot of the internal processes were really slowing down when a patient would receive treatment. And then the last one that they highlighted here is the availability of resources. One big example of this would be not stocking necessary factor products or bypassing agents. So while in the larger hospital settings, those that are often connected to a hemophilia treatment center, those products would be stocked or would be easily accessible. Those hospitals that might be in rural areas or more of a community setting might not have them readily available. So all of that would delay the treatment in this setting. And this was a wonderful study that pulled from the United States as well as some European experiences. So that was a little bit more of the provider lens, but I also wanted to highlight a little bit of the patient experiences. And there was a wonderful study that was published, I believe, last year that I highly recommend people read. So this is a qualitative study. And while they identified multiple themes, I wanted to highlight this one theme that was surrounding the barriers to care and identified needs. And within this theme, in their analysis, they found a subtheme focusing on emergency department care. And within that, their patients or their participants really reported what they found to be big barriers or big issues in the emergency room setting. So one was really that perceived lack of familiarity with the diagnosis, and that is in alignment with what we found in the other study, that a lot of those providers in the ER really are not very knowledgeable about bleeding disorders. There often is a delay in treatment, which is also in alignment with the other study I highlighted. But then there's also what patients identified as a neglect of medical identification cards, so the travel letter that people might have with them, and then a dismissal of the patient voice. Often patients would come in and really tell the providers of what they needed, but that voice of the patient was getting dismissed. So I wanted to highlight a couple of the quotes from this particular research study here to lead us into our further discussion. The emergency department is kind of a death sentence. As a hemophiliac, it is all luck of the draw. I go there and it's kind of like they just treat me like a normal person, somebody that doesn't have hemophilia. Outside of my HTC, 100%, I would say that accessing care has been an issue. They don't always let me take your factor despite having a factor first card. And I'm not clinically trained. And so how do you convince people that you may need something else other than what they are generically thinking is the best intervention, right? So this particular last quote is really going to lead us into our discussion now of how can I, as a patient, really advocate for myself or what my child needs in the situation when an emergency might happen and I need to go to the emergency room. And as a healthcare provider, for those of you that are healthcare providers out there, how can you actually equip your patient to be capable of advocating for themselves in the case of an emergency? So let's get started on this topic. So knowledge truly is power. And the more you know about your bleeding disorder, or the more your patient knows about their bleeding disorder, the better your chances of receiving appropriate care are, The more you can educate those around you, including those in the ER, the better you can communicate about your bleeding disorder to those who need to know, and the more prepared you will be in the emergency. Being prepared is key. And knowledge truly is the key to being prepared. And this is why it's so important to know about your bleeding disorder, but also to be able to communicate about it. And we're going to talk a little bit more about the tools and skills needed for that. So emergencies happen, things happen, a bleed might happen. You might be playing outside with your children and you stumble and twist your ankle, or you might have a fall, or you might get, God forbid, into a car accident, or something else might happen that would warrant being taken to the ER. But it is important to be prepared for this. And it is much more about what you do before the emergency, so being prepared ahead of time, as well as what you're doing during the emergency. But preparedness, again, truly is the key to a good emergency room visit and to making sure that you or your patient really receive the care that they need in this very moment and quickly. So things that you can actually do before an emergency happens. And it's always about planning ahead, being prepared, and really keeping all the things that might happen or might prevent you from getting the care in mind. So we're going to spend a little bit of time to talk about the basics. Then we'll talk a little bit more about being proactive about your medical care and having that conversation with your HTC and hematologist, which is also important for you healthcare providers out there. What kind of things should you actually be talking to your patient about in to prepare them for an emergency situation? So let's talk about the basics. So one of the main components here to start is really knowing the 3Ds. So know the disorder, really making sure that we are aware of what is the exact bleeding disorder we are dealing with. What medication are you taking, or is your patient taking? Where are they taking a factor? What is the exact product? And then along with that, what is the dose of that particular medication? What is the dosage that somebody is taking? Then very often it is helpful to wear a medical ID bracelet or a necklace. Now, some of these are not very decorative, and very often, especially when we're looking towards our younger generation, people might not want to wear them, but they are actually beneficial and helpful. And the more we can really get that ingrained in people, that is really helpful. It is a good tool to have. Now, some people have said before they might actually start tattooing some information on themselves. So just be aware that EMTs or emergency personnel, they will not necessarily look through all the different tattoos that somebody might have on their body to see whether or not there is some medical information there. The other part is that people might have a lot of EMTs, they are not actually allowed to take somebody's wallet and look through that wallet, or in that moment, they might not even think about it either. But make sure that you really have a medical ID bracelet or necklace available. And then for those that have children, really make sure that you teach the children what they need to say to emergency personnel. And if they are too young, just make sure they know to point to the medical ID instead, so that they can really point out like, hey, I have a disease, please look at this. And that will really help direct the care. So some of the other basics is to take a medication and a letter from the HTC along with you as you're traveling, and really plan for your travel. Have that conversation with your HTC and obtain the appropriate documentation that will outline everything that you need. What is your disease? What medication are you taking? And what is the dosage of that particular medication? And then keep a first aid kit at home and in your car. And that should also include gloves, and really make sure you keep that stack. Also take a look at whether or not any of the products are actually expiring that you have in your first aid kit, and make sure you are replacing them frequently. And also make sure that you educate your family members and your friends about your bleeding disorder, so that they can actually advocate and help you in case that you really need it. I know it is always hard to disclosing what is going on with you or where you need help, but you definitely don't want to be in a situation where an emergency might happen and you might need to depend on somebody else, and they are not even aware that you have a bleeding disorder or that your child has a bleeding disorder, because that will certainly delay treatment which can have severe consequences. And then really make sure that on your house where you live and on your department, your house number is visible. So I think we've seen many houses and other things where you might not even be able to see the number clearly, where it might be a very small number on the side somewhere. But in the emergency situation, you want the EMTs to be able to find your house quickly. You don't want them to be circling around trying to identify which house they need to go to. So really make sure that the number itself is very visible from the street. Now, what are some other things that you can do to prepare and to actually plan ahead? So we talked about the basics, and now let's talk a little bit more about being proactive about your medical care. So a couple of things to keep in mind. So when you're not having an emergency, still make sure that you see your HTC and your hematologist on a regular basis. And then also for you healthcare providers out there, make sure that your patients are coming to see you on a regular basis and do appropriate follow-up with them as well. So even if they just have mild symptoms, so you really want to make sure that you're staying on top of any treatment options, medications, make sure you're considering any changes or outdated treatments. And then in emergency, it is really a bad situation when you have to update information and figure out a plan. So make sure that you have a solid plan in place and that you stay on top of all of your treatment and the information about it. The other component to keep in mind, especially for those who have a milder bleeding disorder, is that patients with mild bleeding disorders tend to be more difficult to manage in the ER setting because they're often less informed. And this is really based on some of the feedback that was given from ER staff, that often those who have a more significant severity often have a lot more knowledge about their bleeding conditions. So having just a mild severity shouldn't eliminate being educated and having a plan in place, because you never know when an emergency might actually happen. So other things to keep in mind. So of really being on top of the medical care. We always tell patients to keep a log of all the bleeding symptoms and their treatments. And this is really helpful to also know what actually works and what doesn't work. So keeping a log, writing down all the details is actually very helpful and to have on hand as well. You also want to make sure that patients are tracking any new medications and to see what really affects their bleeding as well. It's important to check the expiration dates on the medication, especially if you have just stored them away. And then if they expire, to make sure that you're actually replacing them and to refill before you run out, because you never know what actually happens. So anybody remember that big snowstorm that happened in Texas last year? So I talked to a family there and they were actually cut off, and it was really hard to get their medication. So it's really important for to be refilled and to make sure that you have enough on hand should an emergency situation happen, just like that. And then also, again, make sure family members know where your medication actually is located. So if there is an emergency, you don't want them to be running through your apartment, through your house, trying to find a medication. They should know already where it is. So in the case of an emergency, they can quickly grab it and have it available. So, and then once you're before you go to the ER, it might actually be helpful to meet with them, especially when you're moving new into the area. Now, many of us are often moving around. We might be taking a new job, might be relocating. So it's helpful to actually meet with the ER in a non-emergency situation and find out, do they have your medication there? Or would you need to bring them in? And then really ask them about that too. In the case of an emergency, can I bring in my factor from home? I do have my medication available. This is my bleeding disorder. This is really what I need in this very moment. Or ask them if they could potentially stock your medication for you in case there's an emergency. Now, another great suggestion that I've actually heard from the community that I wasn't aware of before, but that I think is just a brilliant one, is also to meet with the fire department that's local to your area. So in the case of an emergency, if they know about you and they know that your child has a bleeding disorder or you might have a bleeding disorder, they might actually be able to help you a little bit better because they already know what you need and where you need to go. So you're being proactive of really letting them know what your family needs are. And they will actually do that. So now, what else can you plan? And this is really having a conversation with your HTC and your hematologist. And then for the healthcare providers out there to really make sure that you're having that conversation with your patients about being prepared for an emergency situation. And then let's talk a little bit more about what would be really important to cover in this moment. So what are the reasons when somebody should actually go to the ER? So what are the types of bleeds or types of concern that would warrant a patient to be going to the ER directly and not coming to the hemophilia treatment center or seeing another provider? So that should really be covered in that conversation. Then also talk about the proper dosage of for the different types of disease. How could a patient utilize their factor in that moment or their treatment in that moment? And then what medications might there be out there that could increase the risk of bleeding? And then really important, as a healthcare provider, where would you prefer your patient to go to? Which ER would you want them to really drive to if they would have an emergency? For example, I live in Southern California, I live in San Diego. We have multiple hospitals here who all have really wonderful emergency rooms. However, we had a very particular one where we wanted our patients to go because we could easily access them. We were part of that system and we could work with them directly. It made communication a lot easier. And they were also much more trained and well aware of people with bleeding disorders, and it was much easier to work together. It would definitely decrease any sort of delay in treatment. So make sure that that conversation happens of where to go in an emergency. And then to make sure that all patients have an emergency or travel letter. So that should include the diagnosis, treatment recommendations, the HTC contact information, and then really, really important, it should have some sort of a statement in there that talks about treatment first and really emphasizing that. This is also important to have, not just when somebody's traveling, but to just have it with you as a patient and for the HCCs to provide that to all of their patients in case of an emergency. Okay, so a couple of other considerations depending on what medication is used. I know statement is a little bit delayed here on usage, but just to put that out there if it becomes available again and before. So really know the response. How are you responding to your medication? How is your patient responding to the medication? And how does it work with different dosage? How often is it being taken? And then make sure to really talk to the HTC and the hematologist about any sort or how to use it in an emergency situation. Also consider if you are normally using these medications to talk to your hematologist about the potential of when to use factor and if there are situations where factor should be utilized. And then what is the treatment protocol that should be in place for that as well. Then there's also a lot of people out there who might be using factor. So again, for this, it is important to know the dosage, how much factor should be taken in this emergency situation. And that will really then depend also on the situation and the severity of the bleeding or injury. And then know kind of what the dosage is based on for those who have VWD, and then discuss having the dose of factor at home. So again, have something at home for the case of an emergency. Now, a couple of other things to keep in mind is to really make sure that all the important information is easy to find. You don't want to scramble around in an emergency situation trying to find all the documents and information that you might need in the emergency room once you're there. So really make sure that you already have that readily available to you. So where should I keep my medical information and to make it easily accessible? Let's talk about that a little bit. It's very nice to have like a little laminated card in a wallet or purse. So this is not your medical ID. That is really all the other important information that you might have. So really have that with you. A laminated card will make sure that it doesn't get broken so easily. So there's some other tools listed here. Medical Alert Advantage is one. And then make sure you have any sort of hard copies of important information in a central location in your home or in your car. So you can put them in a binder, in a folder. So have them in a cabinet near somewhere where you can just literally grab it in that moment, or even have it in the glove compartment in your car or somewhere else where you can store it away, so you can easily in a moment's notice just grab it, and everything that you need is right there for you. And then make sure that you actually have important documents in a secure location, and that you can return them to. And make sure that you're keeping any sort of digital copies on your phone, and that you keep all of your information safe. But bottom line, really about your information, make sure that you know where it is and that you can easily access it in a moment's notice when an emergency should occur. Now, what information is actually considered important and what should you keep close? So we talked before about the whole medical ID component and about knowing your 3Ds, your disease, your or the disease in itself, the drug that you are taking, and the dosage of it. But then there's more information that you need to provide once you're actually in an emergency room. And what are those things that you should actually have? So we have them highlighted here a little bit for you. So things to really consider and have available: your name, address, date of birth, a photo if needed, weight, a copy of the insurance card is always needed, emergency contact, and what is the relationship and phone number. I've had this before where somebody asked me for an emergency contact, and I knew the name and then the phone number. I was like, well, I think it's somewhere in my phone, and I don't even know where my phone is. So have that available in that moment so you don't have to look around. And also have information on your healthcare providers. Again, medication is always good. And we're not just talking in this moment about the medication as in your factor replacement or other products, but what else might you be taking? What other medication that is maybe over the counter might you be taking on a regular basis? So those you should have with you too. Are there any allergies that you have? And what about some past surgeries, immunization, and any other medical conditions that might impact you as well? And then there's some specific information that you might want to have available with you. So those include, again, what bleeding disorder actually do you have? What type do you have? And what is the severity level? But then also, who is your hematologist or your HTC? Who are they? What is their phone number? Where are they located? You don't want to be sitting there with your phone trying to find the phone number. Have it available for them so that they can call them directly or immediately. Make sure you have all of your medication, dosage, and depending on location and type of bleed, that you have that information, and other medications you could possibly receive for the treatment of bleeding. So those are really specific to your bleeding disorders, whereas the ones we mentioned before are much more generic. These are specific to your bleeding disorders. This is important information to provide the emergency personnel with. So just to continue this, which is important for you to know is, again, what is the preferred ER? So I've mentioned this before, to really include that with your conversation with the HTC, and to really, as a healthcare provider, providing that information to your patients of like, where do you want them to go? What emergency room would be the preferred one? In an instant of an emergency, you can communicate that to the EMT. You can tell them, I would like to go to this and this ER because my HTC is connected to them, or they can work directly with my healthcare provider because I have a bleeding disorder. Excuse me. And then also make sure you let people know about medications that you cannot receive and the reason. So you don't want to take something that could potentially increase any sort of bleeding. And then potential types of bleeds and symptoms, including risks of unexplained bruising or bleeding, like really explain or have some idea of what some of the signs and symptoms are. So again, for factor, what exactly are you taking? What is the name of the factor that you're using? What is the exact product? And then also know whether you infuse or how you infuse. How do you like to infuse? Are you using a butterfly needle? Is there an IV? Is there a port? And then if there is a port or PICC line, and where exactly is that located? And then how to really determine the proper dosage of that. So have that written down and have that readily available as well. And then again, talking to the hematologist or the HTCs, and then again for a healthcare provider to really provide this information to the patient so that they are prepared and equipped with the right information in the case of an emergency. So should they be treating before a certain diagnostic test is being performed? And then should the ER be using factor or medication that the patient is bringing from home? Should the patient be infusing before they get there? And then is this patient actually trained by a healthcare provider to mix and to administer their own factors? So really have that conversation with the patient, making sure that they are aware of how to communicate this and what the details are. And just a couple of things to remember. And it's always hard to disclose all the details with people. So make sure you're disclosing information about your disease and the information to share with somebody that you truly trust within your family or friend, and really let them know where are the files, where are the hard copies, where is this information in the case that something happens. Make also sure that you're updating that information regularly, especially when you're thinking about children. They are growing, their weight might change, their dosage might change, and so forth. Make sure you're keeping that updated in your records as well. And then really have everything available as a reference. Now, most importantly, keep your information safe. You might want to share with somebody where this information is, but don't widely share it on like social media or something like this. Make sure your information still maintains to be your information and is safe. Now, what to do as soon as an emergency happens. So now we have really covered how can we prepare before anything happens, but what do we do when something actually truly happens and when we are in an emergency situation? So should we go to the emergency room? That's always the important question. Like, is the situation so bad that we should actually call 911 or that we should drive to the emergency room? So in all honesty, if somebody is unconscious or experience uncontrolled bleeding, or they have some sort of a head or neck injury, you need to go immediately to the ER. But in generally, when in doubt, always call your HTC. Describe the injury and the symptoms in detail, and they will be able to direct your care. But again, unconscious, uncontrolled bleeding, or any sort of head or neck injury, proceed to the ER. Out, call the HCC, but it's always good to go to the ER. A couple of other things to consider. So it's always good, as I said before, to give your hematologist or your HTC a call. Let them know what is happening, because then they will actually be able to call ahead. They will be able to actually communicate with the ER of like, my patient X, Y, and Z just experienced this injury. They are on their way to the ER. Please keep X, Y, and Z in mind. We often did that. We either might have had a patient who called us and we sent them directly to the ER. And then while they were getting to the ER, we already called ahead to let them know what is happening or what is to be expected. We might have also had a patient in the clinic who needed to then proceed to the ER, where we also might have called ahead and put all the notes in the communication. And then make sure as a patient to bring a close family member or friend. I know in this whole COVID situation, that is often very difficult, as they are not necessarily letting a lot of people in, but communicate that you would love to bring somebody. It's always helpful to have another person with you. It's also very helpful to have another person who's knowledgeable about your disease with you, who can really help you advocate in the instance of an emergency and who can keep a close eye on what is happening in the ER. I know, again, it's not currently available, but make sure to take Stymate with you, even if you already used it. It might help get it, eliminating any sort of confusions about the different types. And then a lot of hospitals will have your medication available, but it's not a guarantee. So it's always good to take it with you if you have it available. I know this is with this particular medication a little bit difficult right now. But for factor users, make sure to take a dose of factor with you. Again, as I mentioned multiple times, many people, they may not have the factor available in their pharmacy, and it may delay treatment. It is one of the big factors causing delays in treatment. And if you can infuse beforehand, if possible, treatment always first. And then ask your HCC and hematologist to give the ER again a heads up, and that a factor will be needed to be ordered, and it can be brought in, or they can direct them that it's okay for the patient to bring in their medication from home as well. Now, there might be a situation that an injury is so severe that a patient might not be able to actually drive to the ER, be driven to the ER, but that 911 needs to be called. I completely understand that that is often very nerve-wracking for many people. It is very anxiety-driven. A lot is happening, and a lot of worry comes along with it. But in order to not delay treatment and to get the potential best outcome for either your child or yourself, it is most essential to stay calm and to answer all dispatchers' questions. They are very trained of getting the most important questions to get help to you as quickly as possible. However, it is absolutely vital that you tell the dispatcher that the person has a bleeding disorder, or you might actually use the term bleeder. So again, keep in mind, these people are not trained in bleeding disorders, like a hematologist or an advanced practice provider, or somebody else who's actually working in an HTC, but they might know the term bleeder. It is very commonly used, and it might ring an alarm bell in that moment. So feel free to utilize that term. Now, then an ambulance might come. And again, these people are trained for saving somebody's life and bringing them to the services they need as quickly as possible. So in order to emphasize good communication and again, to receive good treatment, use short, simple words, again, like bleeder, and make sure that they are aware of the medical ID bracelet. Point to it, point it out, let the person know that a medical condition is here. And then again, ask them to go to your preferred ER if possible. Sometimes it might not be possible, but if you can have that conversation with them, that because you're a bleeder, you need to go to the specific ER. And then give them as much information as you can, including a copy of your medical information if it is available. It will help them again to get you the care that is needed as soon as possible. And tell the responders at each level of care that you have a bleeding disorder, or your child has a bleeding disorder, or that they are a bleeder. That little piece of information might actually fall through the cracks as a person is being handed over. So make sure at each and every instance of level of care, you're reiterating the point, I am a bleeder, or my child is a bleeder, or I have a bleeding disorder, or my child has a bleeding disorder. Always reiterate this point. Now, keep in mind, EMTs, they will provide, again, emergency medical treatment, but they most likely will not be able to administer factor in that very moment. They will transport you, make sure you're as safe as possible, but they might not be able to administer factor. So keep that in mind again. And then you might be entering into the emergency room, yet another level of care. So make sure that if you have any sort of questions, you can always go back and ask, can you spell that for me? Really make sure that you're in clear understanding of what medications you're receiving and what care you're receiving. And when in doubt, always ask questions. Now, very often it is important to really describe your injury and your symptoms. We sometimes maneuver back that we are describing our disease, like I have this bleeding disorder, it does this and this. Sometimes it might be helpful in an emergency situation to describe the injury and describe the symptoms. So first, you're often talking to a person at the check-in desks, and you need to, again, let them know that you're having a bleeding disorder. They might not even know what that is. So as they may not be a nurse, they may not be the triage person, but they do need this information. So make sure you explain that again, and then explaining that your bleeding disorder might actually have caused this problem, or is making the problem that you're having way worse. So really reiterating that point again. And then describe everything very specific and precise term, and don't downplay what is happening. So often we say like, oh yeah, I'll be okay. I'll be okay. It's not that bad. I've had this before. Don't downplay what is happening to you or your child, and instruct your patient that they shouldn't be downplaying the symptoms that they have. That way they're really receiving care quickly. And then make sure that the ER staff actually talks to the HTC or the hematologist. Let them know that you have already called them, or to call them directly to communicate the best care protocol for you, or the best plan of care for you in that moment. So again, we mentioned this a little bit before, but make sure that they know that you need to receive a specific dosage of this medication that is for your particular bleeding disorders. So that needs to be communicated in the case of DDAVP. And then for factor users, a couple of things to remember. That sometimes the ER staff will not let you administer your factor, even though you are normally on prophylaxis and you're regularly treating yourself, or you might be treating your child. So they may not want you to do that in that very moment. They might also not be very used to people being so knowledgeable and being so educated that they can do that. But you can offer to show them how to mix the factor, or at least inform them that directions of mixing are in the instructions in the box of the factor and so forth. So you can communicate and work with them. And also make sure for factor use to ask how many units they are planning to give you. Again, hopefully you have done all the prep work and you communicated with your HTC and your hematologist who have given you a direction of how many units to utilize in this instant. And be wary of describing your bleeding disorders as being like hemophilia. You do not want to create any confusion about treatment options. So let's say you have a different bleeding disorder and it's you have VWD, or you might have an ultra rare factor deficiency or platelet dysfunction. Be wary a little bit about saying like, oh, it's just like hemophilia, because it actually might impact the treatment you get. So be sure you use accurate terms and accurately describe what bleeding disorder you truly have. So really making sure that you're standing for yourself and you're advocating for the care that you or your child need. So make sure that before you're receiving treatment, they have actually communicated with your hematologist or HTC. So your HTC will hopefully provide you with a number to call in an emergency situation. So healthcare providers, make sure that your patients have this number available. And then if they are not communicating with them, just call yourself, pick up the phone. Most likely you will have your phone with you, or somebody that has traveled with you. Feel free to pick up the phone and actually call your HTC and hematologist, letting them know, I'm in the ER, I have this and this injury. Please communicate with them to make sure I'm getting the treatment that I need. And that is very important. Make sure you pay attention to questions that the ER is asking. It kind of can give you a little bit of a clue or indication of their knowledge level, and can kind of indicate how proactive they are. So make sure, again, that you're really conveying your symptoms. Let them know, bring them into your disease, share what you know about your treatment and your plan of care, and don't just describe your diagnosis. So I want to say this over and over again a little bit, just to point out the importance here. Really make sure you're explaining what symptoms are you experiencing, what injury do you have, and not just say like, oh, I have von Willebrand's disease, or I have hemophilia. So really make sure to point out the symptoms that you are experiencing in this very moment. So just a couple of other little pointers here. So really to advocate for yourself. So show documentation and emergency plans to your staff. So point out the documentation that you have. Make sure you're asking for the names of all the medications that are being given to you and the reason why. Sometimes you might be given something that you shouldn't be taking. So make sure that you know exactly what you're receiving and why, and keep a document on that. And then keep all the notes with you, tests, treatments, and times that might be really important for the continuation of your care as well. So other couple of pointers. when you're advocating for yourself. Remember, we are all working together as a team. We are just coming from different lenses and different backgrounds. And we want to work together to really make sure that you are receiving the care that is needed. So be patient, but be persistent. So always make sure you continue to communicate, but don't be confrontational. You want to work with the healthcare providers. You have a lot of knowledge that you can bring to them and you can educate them as well, but don't be confrontational. Make sure you really call your HTC and your hematologist to make sure that they are aware of what is happening and you're receiving an appropriate treatment and care. And then very often this concern about bruising comes up, especially when we're having a child. So the ER staff is trained to look for any sort of signs of abuse. And I know this is often a big discussion when we're talking about children with bleeding disorders, as they bruise very frequently. So you can explain that, stay calm in that moment and explain what some of the signs are when somebody has a bleeding disorder. So a couple of other things to keep in mind. The people in the ER, they are there to help you. They want to genuinely help you. But so make sure that you're still respecting them and have reasonable expectations. Again, they are not trained in bleeding disorders. That is not their specialty. So they might have very limited knowledge, but bring them along. So this does not mean that your care should suffer through that. So really communicate with them and be proactive. And then keep in mind, emergency rooms are very, very busy places, especially in the situation we're in right now where we have an ongoing pandemic. So keep in mind that they are often running between many different patients that they are juggling simultaneously. And so they are also very much trained to verify information. They might ask you frequently, and they really want to make sure that they are giving you appropriate treatment, because that is also essential for keeping their license intact. And they will make sure that you will get the best care. That is really their desire. And keep in mind, though, that maybe the way they are working might be different from what you're used to. Again, it is an ER and the environment is often a little bit different there. So general tips, just a few more. We are almost done here. Remain calm. I know it is an emergency. It is often anxiety driven, but the calmer you stay, the more information you will remember, and the more you can advocate for the care that you need or your child might need. So make sure that the people at every level of care know about your bleeding disorder. You will maybe meet with an EMT, make sure they know that. When they are handing you over to the ER, make sure the people that you are seeing you now are aware of that. Communicate with the nurse that is taking care of you. Make sure you're communicating with the ER physician or the advanced practice provider that is taking care of you. Always communicate over and over again that you do have a bleeding disorder or your child has a bleeding disorder. And don't wait until a problem becomes a crisis. You might have a very minor injury that you think you can easily treat, but that can often turn into something more serious. Don't wait for something to be extremely serious before you actually get the appropriate treatment. And ideally, go to an ER that has your factor or your medication. Make sure you go to the preferred ER by your hematologist, if it is available. If you're traveling and you're not near there, of course, you will go to the nearest one. But if you can, go to one that actually has your factor and is knowledgeable about bleeding disorders or directly connected to your HTC. And then make sure to educate yourself. You're here today. You've learned a lot about how to be prepared for emergency situations, but make sure you educate yourself, you educate those people around you, and to be prepared truly for an emergency situation. Remember, preparation is key to a good outcome. So a couple of things that I wanted to highlight you to help you prepare for an emergency situation. If you're a patient and a family member, we have a wonderful initiative that is coming your way very soon, which is called MASEC for You. And one of our first MASEC for You items will be a wonderful summary of recommendations that are important in an emergency situation and to really advocate for yourself in the ER. Now, MASEC for You is really highlighting important elements from the MASEC recommendations that are being put out to healthcare providers, but are really there for our consumers to take in hand and have some documentation with them. It will come to you very, very shortly. So look out for those. And then for any of the healthcare providers that are joining us today, there's a specific document within our MASEC documentation, which are the guidelines for emergency department management. And you can find those on our website as well. So with this, I would be happy to answer any questions that you might have. I'm having some other information here as well.
That was great. Thank you, Lena. One quick question that we have is, do you have a general date or timeline as to when the community will have access to MASEC for you? I know you said soon, but...
It is coming very soon. We are just waiting on a couple of final little tweaks and edits here, but it will come within the next couple of weeks.
Okay, very exciting. And we have one question in the chat. I'm unsure if you can answer it, but I'm going to ask it anyway. What would you, let me go ahead and share one screen real quick.
Sorry.
No, that's okay.
Dropped off.
What would you recommend for people who don't have a concentrate or factor? I think they mean when they're going to the emergency room. What would you recommend for them?
So I have a follow-up question on that. Would you be regularly taking medication and you just don't have it at home available? Or is this when you're treating generally on demand?
We have the response as severe factor 5 hemophiliac. Yep.
So first recommendation obviously is talk to your HTC and your hematologist there to really come up with an emergency plan of should you maybe have something available for you at home, or what is the plan there. So my biggest recommendation is to really connect with your primary hematology provider, let it be at an HTC or elsewhere, and to really discuss what you should do in an emergency. If there is some medication that you should have available for you at home that you could take before going to the emergency department, or if there should be some other plan in place. So my first stop, or my biggest suggestion there, would be to really set up a meeting with the HTC to discuss an emergency situation plan.
That's great. One more question for you. How can a person of color navigate the ER when you are seen as drug seeking? We are limited in pain medication, so they see it as being preferential. It's a big one.
That is a lovely question. Thank you so much for asking this. So this is a situation that we often have, and that is impacting a lot more people of color, where a lot of patients are really put in this category of drug seeking and needing pain medication. We see this significantly also in people who have sickle cell disease, where pain management is often delayed, and there's a big correlation between the color of their skin and whether or not they are getting treatment, and treatment fast. So my pieces of advice here, and this is more from really personal experience, is to, again, really stating very clearly that you do have a bleeding disorder, or that your child has a bleeding disorder, and to clearly, in very short words, explain the signs and symptoms that you are currently experiencing or your child is experiencing. But then also to call your hematologist or your HTC to let them know what is happening, because they will support you in this. They will call ahead, letting the ER know that you're coming, you're on your way, and this is probably what you will need. And they will also advocate for you in the sense of the setting. Now, you might actually be there and might not have your voice heard. So most importantly, stay calm. Continue to explain what is going on with you, and then feel free to call your HTC again, explaining what is happening, that you're not getting the treatment that you really need, so that they can step in and help you as well. But the HTC is there to support you. And when I was working at the HTC, I know we very often directly went over there. We would drop everything in the clinic, and we would sometimes, our social worker would go over, a nurse would go over. I have gone over several times to really help the patient navigate and advocate. And if you're running into any issues there, you can really lean on them as well. Did answer to your question. But we have a lot of work to do there, for sure. Yeah.
Awesome. Well, thank you. I want to thank Lena once more for taking the time to join us this afternoon. We appreciate your time and expertise. I'd also like to thank each one of you for joining us. Please note that this recorded webinar will be available on Friday, February 11th at hemophilia.org under the Events tab with all of our archived webinars. Also available in the Events tab is our upcoming schedule for our weekly Wednesday webinar series. Thank you for joining us this afternoon and have a wonderful week.
Thanks, Lena. Great job.
Thank you.